my name is Ophelia. I'm the Clinical Product Manager at SSEM Mthembu Medicals. Welcome to our training channel. Today we are doing something completely different. Nope, before you say it, it is not a product training video. Today we're going to learn more about World Prematurity Day straight from the experts. Come with me.
World Prematurity Day is on the 17th of November every year. It is to recognize and also bring awareness to the presence of prematurity and premature births. It is an important day of the year where the challenges and the difficulties that are faced with regards to prematurity is just enlightened to the community and the world. So a premature baby is any baby that is delivered before 37 weeks. So a normal pregnancy is around 40 weeks, and from the time that they are conceived all the way until 40 weeks, they not only grow physically, but they also mature in their systems and their organs and how they function. So we can understand that when a baby is born prematurely, they are born before they grow in full size and also before the organs and the systems can function at their optimum time. So at Pulusong, we serve the community of KwaZaduza, which is KwaThema, Tsakani, and Duduza. We pride ourselves with nursing babies even as small as 600 grams. In the past year, our smallest survivor is 700 grams and was born at a mere 23 weeks, so which is wonderful. We do give clinical care and health care to babies that are born much smaller than that as well. The devastating impacts that a premature baby has on a family is unmeasurable. From the baby to the mother, to the family members, to the community at large. Not only is it an emotional roller coaster, it is a journey for those that are involved. And it is a long process during the time that the baby's been admitted, separated from the family members, and then also having to adjust to a home environment after a baby has gone home. It is all very challenging things. The other thing that we tend to forget as well and to overlook is the impact of prematurity, not only on the community, but on the healthcare system and also in the world in general. Unfortunately, prematurity is the most common cause of death in children under the age of 5 years old, which is a great number. So at Pulusong Hospital, we are already in the process of developing our own mother and child facility. We want to continue giving impeccable service to our community, but we also want to deliver it in such a way that it is family, it is love, it is in an environment that is feasible and sustainable to the people that we are nursing. So we would like whoever it is that would like to be a part of this wonderful dream, they can communicate with our communications office at Pulusong Hospital on 011-812-5000, and they can assist and say how they would like to contribute to this great initiative.
Babies are born prematurely for a lot of different reasons. So there are reasons that related to the mother's health, her physical condition, some of the habits, and also events that can happen once someone is pregnant. And these are normally not picked up early or not known at all. Once a mother decides that she wants to be pregnant, the things that she can do to make sure she doesn't have a premature baby are firstly lifestyle modifications. And by that I mean stopping smoking, less use of alcohol, taking supplements, weight reduction. If they have a medical condition, to make sure that is controlled. And I'll give an example. A mother that is hypertensive or has diabetes needs to make sure that is controlled before she falls pregnant. That reduces the risks once she's pregnant. And once she's pregnant, if there are any infections at all, urinary tract infection, bacterial vaginosis, if they are known to have group B streptococcus, all that needs to be treated. That reduces chances of falling pregnant. And medical conditions need to be well controlled once the mother is pregnant. In a mother that has had a premature baby before, it needs to be known in the pregnancy so that we can look at modifiable risk factors in the current pregnancy and correct them. There are signs and symptoms that the mother can have, which is important, is looking at the length of the mother's mouth of the womb. If it's short, that can put her at a risk of a premature baby. If you have low abdominal pain that may feel like period pains, if you have lower back pain that does not seem to respond to normal pain medication. That may be an indication that you are having a premature labor, and that is a sign or an indication to go to obstetrician or a nearest hospital, because they can be able to stop the labor and have you progress with the pregnancy normal. So in the area that we work in around Polisong, we have a specifically high rate of teenage pregnancy. Our teenage pregnancy rate is actually higher than what the national average is. Teenage pregnancy is a risk factor for having a premature baby, and that is also related to the fact that most of them also use illicit drugs and smoking, and are most likely to have infections as well, and also just being from a poorer socioeconomic background. What we do regarding the issue of teenage pregnancy as a hospital is we have outreach programs where we call it the doctor in the classroom, where we go out to educate and make sure teenagers have access to contraception and they understand what it is. We have not been able to do it due to lockdown restrictions because of COVID-19. It's difficult to measure whether the program has an impact because we still see a lot of teenage pregnancies in the hospital. What we need to do is rather conduct a study and see if our numbers have changed since the program have started, which we haven't done so far. If anyone needs to be involved with the program, our doctor in the classroom program, they need to get a hold of the communications department at Polisong Hospital, and there they will be advised as to how to get involved.
The theme for this year, which is Together for Babies Born Too Soon. This is a very, very fitting theme because when we speak about babies that are born too soon, basically we speak about our premature babies, and when we say that they are born too soon, we actually say that they are not really prepared for life. Within the theme, it says Together for Babies Born Too Soon. This is also very important because a baby that is born too soon needs a team of professionals to care for that baby, and they need to work together to ensure the best possible outcome for the patient. The amount of professionals that are involved, I think the first and most important professional would actually be the mother, and she plays a very, very, very important role in terms of the nutrition of the baby, in terms of what we call KMC. The mother keeps the baby warm and gives the baby thermal care. That helps the baby to grow, and that may lead to discharge easier or faster. Unfortunately, with the lockdown, most of our mothers were not able to come through, and it was a challenge for us because we struggled to get breast milk for the babies. At times, the mothers themselves had to call through the hospital and continuously find out how their babies are doing. So it was a real challenge for us. The other professionals, of course, is our nurses that are with the babies 24/7, giving medication, feeding the babies, changing them. So their role is also just as important. Then we've got the allied healthcare workers, which is our speech therapists, our dietitians, our occupational and physiotherapists, as well as the social workers. So all of these professionals, they need to work together to ensure that this baby that is born too soon has the best possible outcome. There are short-term complications as well as long-term medical complications that premature babies can face. And I'm going to focus on the long-term medical complications. I'm going to focus on 3 of them. The first one would be what we call retinopathy of prematurity. This occurs when the blood vessels in the eye are not developed due to the baby being born obviously prematurely, and so there's an interruption in the development of those blood vessels. As a result, and with the baby being exposed to prolonged oxygen, that can further worsen this condition. As a result, this may lead to visual impairment as well as, in the worst case scenario, blindness. The second one that I'd like to mention is the recurrent chest infections that the baby may develop as they grow up, and they might require repeated admissions to hospital for those chest infections. Probably a very big one is developmental delay, or a condition known as cerebral palsy. Cerebral palsy is a non-progressive but permanent insult to the brain of the baby, and this happens early on in development, and the complication of that can be cognitive, intellectual, gross motor and fine motor development issues, as well as they may develop a condition called epilepsy. They may have behavioral issues as well as they are growing up. So all of these things are basically the most important long-term medical complication that these patients can get here. All these long-term medical complications can have a huge impact on the parent as well as on the community. When you look at what I've mentioned, a child that's born with a birth weight of 850 grams. Now that is very, very small. It's a very, very small weight. And that baby can only be discharged when he weighs around 1.65 to 2 kilograms at most. What this means is that it's a very, very long journey for the mother. The mother has to come to the hospital every day during that time, and it can take up to weeks to months before the baby is discharged. That can be very, very taxing for the mother in terms of finance, having to use public transport to come to the hospital every day. She might have other children at home, a job, or might be attending school. So all those things have a huge strain or a huge impact on the mother. Now the baby is discharged, and the baby develops all these developmental issues. They may have the retinopathy of prematurity, which may mean that they will become blind, or they may have cerebral palsy. This means that this patient will now be fully dependent on the mother for the rest of his or her life. They have special requirements, and the special requirements might be very, very costly to the mother as well. There might be some behavioral challenges at school. Even so, in the community amongst peers, there might be some issues that may develop in terms of the child's behavior and the manner in which they present themselves in society. When I look at our situation at Leratong Hospital, I think there's a few things that the general public can assist us with. With our patients, we've got a shortage of the pulse oximeters. They are very, very important in terms of checking the levels of oxygen that the patient is getting and making sure that we are not giving too much oxygen. Because I've mentioned earlier that retinopathy of prematurity, 100% oxygen or high levels of oxygen is a huge risk factor for retinopathy of prematurity. So the pulse oximeters usually tell us if we are giving too much. It helps us to decrease the oxygen on the patient, and as well as if we have enough pulse oximeters, we won't have to use one pulse oximeter throughout the ward, which can be a risk factor for the development of infection. We really have a shortage of blankets for these patients. Thermal care, kangaroo mother care, that is very, very important. They need to be kept warm at all times. So if the general public can assist us with blankets, that would be highly, highly appreciated. Leratong Hospital will be hosting its Prematurity Day. We know it's on the 17th of November, but we will be hosting our special event on the 20th of November. This is a very, very exciting event for the staff as well as for the mothers. I think at Leratong we can boast we've had a few patients that were born with weights of 800 grams that have grown up to be teenagers to contribute positively to society. We host and we invite them to come to share their story with us. We have our mothers here that are in KMC. They usually join the event. So it's a nice event where we celebrate World Prematurity Day. We know in the past people have come through, they have donated kiddie bags that have got a whole lot of accessories for babies and things like that. That usually makes a huge difference to our patients. You may feel free to contact Sister Ramasolo, who is in charge of Ward 4 or the neonatal ward.
We wear the color purple to represent World Prematurity Day. So it's thought to represent 2 or 3 things. So the World Health Organization chose purple because it represents sensitivity. So if we look at our preterm babies, they are small, they are fragile. Everything about them is very sensitive. The way we care for them, it also represents their individuality. So not all preterm babies are the same. So as much as they may be born around the same time, or maybe the same weight, but their cost will be totally different. Then some people will add the fact that they are very exceptional individuals because they always survive against all odds. As a doctor who is also a mom to a premature infant, or should I say an ex-ICU child now who is 7 years old, I must say it's been quite interesting and a challenging journey. So if I were to take you through how my journey was with my daughter Mandilake. At the time I was still specializing in pediatrics in Cape Town. Then I went for my usual checkups and then I was told that she wasn't growing and we never understood why. The following 2 weeks I was told, okay, things are going better, and then with my next appointment it was like she has to come out. So, and this is what a lot of our mothers also go through. You come in for your checkup and the next thing you are getting admitted without really knowing. So obviously you go through the emotions. Is this baby going to survive? What is happening? And the adrenaline kicks in. You're just in a bit of a zone. Then I was admitted for a few days, and then Mandilake came early Sunday morning at 9 o'clock, weighing 765 grams. We were lucky because we were in a private hospital with all the resources, and they did all they could for her. She had everything in the book, so she bled into the brain. She had a big hole in the heart, so a lot of premature babies, most of them will have that hole in the heart. It's what connects the baby to mom, but it should close once they are born, but some it tends to persist and can cause lung problems in the long run, which was the case with her because she had to be on the machines for like more than 2 weeks, and then she went out of the machine, she bled into the lungs, had to go back into the machine. Then she was on oxygen for a long time, and then we were worried about the eyes. Luckily, there was not a lot of damage because we know oxygen in premature babies that can cause blindness. So we had all the problems that you can think of. We've been through that. Touch wood, we survived. But obviously, a baby that small, you will expect some problems in the long run. I always knew that she was going to have some issues. So when she started school in grade R, they always mentioned that she wasn't holding the pen so nicely compared to the other kids. So we also as parents had to put in the effort to make sure that, you know, we send her to OT, to speech and all of those things, which was a big challenge. You think you've gone over the premature problems and then they catch up with them later on when it comes to the schooling. She's now asthmatic because she spent a lot of time on the ventilator. As of last year, she's wearing glasses. But overall, I think she has done very well. She is now doing gymnastics. She's a very good ballet dancer because she's quite petite and she's very light on her feet. It shows that with the right people, right resources, premature babies can actually have and live like a normal life. So now as a doctor, that journey taught me, I'm a pediatrician and I'm specializing now in neonatology. So it taught me to be patient with the mothers because I understand exactly how they're feeling. I understand what they're going through, the emotions. 1 minute you're not sure, the next minute you think you can do it, the next minute you're just falling apart, the hormones are all over the place, and a lot of our mothers unfortunately are here on their own. When I open up to them and I tell them about my journey, they are more encouraged and they'll tell the other moms that, you know, actually this doctor also had a preterm baby, because I think a lot of them think that it's only a certain group of people or a person that can have a preterm baby, whereas any one of us can have a preterm infant. And in my case, they didn't find out what was the cause of the prematurity. I always feel that if Mandilake at 760 grams survived, I feel it's up to me to give the next 760 grams a chance. Luckily at Rahima Musa, we have a great team of ladies, and we all strive for the best thing to give our premies the best chance in life. So World Prematurity Day matters a great deal to me, I suppose, as a mom of a premature infant. Having gone through what I went through with Mandilake, I think it's important to raise awareness, and we usually use this day to teach our mothers about prematurity, how to look after a preterm infant, and also to educate the communities. It's quite important for everyone to be involved, not just the parents, because it affects the whole community. If a mom doesn't bring the preterm infant for follow-up, that child can miss up on important rehabilitation visits with the physiotherapist, and that first 1,000 days of life are quite important in a preterm infant, because during that time, that's when growth and neurodevelopment occurs. So if you miss that time, then there's not much we can do after that in terms of helping your child. That's why I liked the theme for this year, because it talks about togetherness and talking about the future of our preterm infants. Because with the struggles that we had, a lot of our schools think that kids are the same. They've got this one-size-fits-all approach. Whereas if we were to think of all the challenges of a preterm infant and see what programs can we start in the communities or the government, do we need to start them earlier to prepare them? Do they need to go for rehabilitation or school readiness assessment before they can go into mainstream? So these days, like premature days, they sort of put up that agenda of premature babies. So I'm hoping things like this will sort of get the discussion going. Because if you think about it, you spend a lot of money ventilating this child. Mandelake's bill was over $1 million in that 4 months. Now, you're not going to get a return on investment if you don't invest on this child's health, because at the end, you want to produce a well baby with good quality of life and someone who's going to be an actively, economically active citizen. So if you're not, then you're not getting your money back. So I think government needs to look at all those things. So it's not only us as doctors, we should all work together and make sure that we propel our preterms to be the best citizens they can be. This year, on the 17th of November, which is World Prematurity Day, we will be hosting our mothers. We will be having a picnic outside to comply with the COVID rules. And that time is usually really time out for the mothers. We usually pamper them. We give them small gift packs. We also educate them. So there'll be a dietitian who tells them how to feed a preterm infant. There's a nurse who teaches them on how to look after a preterm infant. Then the OT and the physiotherapists are the ones that help us with exercising, building up those muscles. And then there's usually a doctor then who talks about the problems that premature babies face, and also to inform the moms about our follow-ups and all of that. And we usually finish it off with a lunch for the moms. And a lot of the times we would invite our ex-prems, and then so that the moms can see that actually there's hope at the end of the tunnel, so babies do actually go home.
I hope you've learned a lot like I have. To see more videos like this one, please don't forget to subscribe to our channel and like these videos. And of course, we would love to hear your comments. Thank you.